We talked about this one, about falls as well, but also advice to caregivers, people who are at home with someone living with heart failure. Any just warning signs or things that they should look for that perhaps it is time to talk to their family physician about, I'm not sure if the medication balance is right just yet,
Right,
maybe we need to tweak it.
right.
What advice would you give to people living at home with someone with heart failure?
If you have somebody at home with heart failure, diabetes and heart disease and hypertension, always diet is very important. The Joint National Commission for the Management of Hypertension, they recommend a low salt diet, which actually is less than 2,400 milligrams of salt in a 24-hour period. So I always tell my caretakers at home, make sure that they're eating healthy. Also, what signs to look for instance, if a patient is going into acute heart failure, shortness of breath is one of them, for instance, or if the patient tries to speak and they get short of breath when they speak, that's another possible sign that the patient is going to acute congestive heart failure. I know sometimes it's difficult to do, but I like my patients, if it's possible, to check their weight on a daily basis. If they see that their weight from one day to the next, or for over the last several days, their weight, for instance, went just from 130 pounds to 140, that's a significant amount of weight gain. That means water retention, so it's time. If that happens, it's time to call your doctor. If you see any lower extremity edema, regardless of the medications, call your doctor. If you see that the weight is going up, call your doctor. If you see that you're getting short of breath, just with short distances of walking, that's time to call your doctor.